Sleep apnea in children is probably even more serious of a problem than it is in adults. There's a big distinction to be made, though. A lot of people are familiar with adults who snore or stop breathing, that kind of thing. In children, it's a much more different thing. Sleep apnea itself is defined as stopping breathing for a set period of time while you're asleep. But in children, not just sleep apnea itself is a problem. What we refer to as sleep-disordered breathing is an issue. In other words, children who snore and even snore just a little bit. And that's an important thing to be aware of because for a couple of reasons. One is that as adults, we interpret what snoring is to our experience with a parent or a spouse that does a lot of snoring. But in children, it's a lot more vague and subtle. And the second aspect of it is that in children, even a little snoring can have the same consequences to them physically as true sleep apnea, true cessation of breathing. So for children, making the diagnosis of sleep apnea perhaps isn't as important as recognizing that there are disturbed breathing patterns during sleep. Breathing is, of course, the number one priority. You need to breathe to survive. And so the body goes out of its way to make sure you do breathe. So if a child has a problem breathing at nighttime, then the body gets itself into an excited state and it has to overcome whatever obstacles there are to breathing so that this child will start to breathe. And what it does is the body starts to produce more cortisol, getting the muscles energized and exercised, and finally get you excited enough that you overcome these obstructions and you open up the airway and get the air in. A syndrome called failure to thrive, growth issues. It can be a triggering cause in type 2 diabetes, ADD and ADHD, attention deficit disorders, learning problems at school. Now this is a picture of a little 8-year-old guy, and you'll notice what you see is all of this acid erosion on these teeth. This is a young man who does have sleep apnea, and one of the consequences of sleep apnea and prolonged exposure to cortisol is they start developing gastroesophageal reflux disease. In other words, they're regurgitating stomach contents, which are of course extremely acidic, and they have actually eroded and damaged all of these teeth. There's a whole host of problems. Asthma is another really good one because of the altered immune response.